Hello, welcome back to another episode. I'm so excited to be here. Before we dive in today, though, I do want to mention that this episode and all my episodes are for informational purposes only. So it's not a substitute for professional medical advice, diagnosis, or treatment. So always make sure to consult with a healthcare provider with questions about your health. But today, I'm so excited. I have a wonderful guest, Hannah Lewis. She is a board certified family nurse practitioner with a deep commitment to helping patients to feel truly seen, supported through their wellness journey. She has experience in both conventional and integrative medicine, and Hannah combines advanced diagnostics, lifestyle medicine, targeted supplementation, nutrition support, and personalized treatment strategies to help patients uncover their root causes behind chronic health concerns. So, right in the realm of what I do. So, I'm so excited to have her as a guest because she is also a nurse practitioner, which I am not certified in any of that. So I'm super excited to chat more today about her experience and with hormones. And yeah, so let's dive in. But thank you so much for being here.
Yeah, thanks for having me.
Of course. So tell me more about, since my audience doesn't know, yeah, who you are. Like, tell us more about like functional medicine, how you got into that more and pulled you beyond conventional.
I really like to say that my functional medicine experience, or more this holistic realm, really began as a child. It was always my parents' priority that it wasn't just a quick doctor's appointment. It's what could we do to manage things at home or go see a chiropractor or do other modalities when it came to like if we weren't feeling our best. And then I really had a real shift in perspective of just like what I wanted to do with my life when my grandma got cancer for the second time. And, this is the first time I'd heard about celiac disease and like the importance of blood sugar regulation and how this supported like cancer care and your hormones. So it was just a really, like I say, like trial by fire learning experience. And I got to see how the nurse practitioners and just nurses in general really got to be alongside the patient in their health journey and look at them as a whole. And I was like, I want to do that. So I switched my first degrees in biology, and then I got my accelerated nursing degree for a bachelor's. And then I spent some time in the pediatric ICU for 5 years, and then went back and got my nurse practitioner degree. So,
Oh, wow.
yeah.
And so, yeah, you worked with a lot of kids too. How did you like that? Being the
Oh, I love
ICU?
working with kids. Yeah,
Oh,
I say, the health of our future really starts obviously at this young age, and what we can do when they're little babies and even in that realm really just sets them up for success for the whole rest of their life. So, I have two kids of my own. I say my
mhm.
favorite title is being a mom. But it has been just so great to get to help kids be well as well.
Oh, that's so amazing. How old are they?
My daughter is 3.5, and then my son will be a year in about 2 weeks.
Oh my gosh,
Yeah.
exciting. So cute. And tell us more about your practice.
Yeah, so I after my maternity leave, so July 7th, I started building my own practice with another colleague, and we kind of went through all of that, and then I opened Wildly Well in the end of May. So I'm located out of Osseo, Minnesota. I am licensed in Minnesota, Wisconsin, Florida, North Carolina, and soon to be Washington. Um, so I see people virtually from kind of all over. And yeah, I say again, my youngest patient is about 6 weeks old, and my oldest patient is 85.
Oh my God, that's so awesome. Such a wide variety too, which I'm sure you get to see a lot of different things. What do you really love to, work on as far as with patients and like what are you super passionate about? Like is it kids, is it grown-ups or like yeah, tell us more about that.
I think it's honestly a little bit of both. I think a little bit of the life that I'm in right now, or just the season of life of like really helping with fertility and postpartum and all the hormone changes that surround that. But again, treating kids from an early standpoint when they're like not going to the bathroom regularly, or they have eczema, or we're seeing a lot of like allergies. And then in their later years, ADHD development. But I say that, it's nice to tie into where I'm in at life. And so I
Mm-hmm.
feel like a lot of my population fits into that group. But then I also have a big group that's like perimenopause and menopause. So,
Yes. And what are you seeing more and more right now, especially with women? Because for me, like I
yeah.
work more exclusively with, yeah, women between like, yeah, I would say like 20s to like 40, 50. So
Yeah.
in your practice, like what are you seeing a lot right now with women?
I think that one, I think a lot more women are being open to hormone replacement or having more discussions about maybe why this is important. I think a lot more females are being aware that like birth control is not an answer. It's just a band-aid solution. And so I'm seeing a lot more women say, like, I got handed birth control and metformin, and they told me that that was it and that there was nothing else to the story. So that's kind of been more of the recent topic, but it's really been empowering all these females who are like, I've just seen what the benefit of like hormone replacement can be, or like what, like what it means when my hormones aren't in good alignment and how that's affecting
Hmm.
my life.
Yeah, I love that. I love seeing that too. Like women just, yeah, being more open to like, okay, there could be another approach or just looking deeper at understanding your body.
Yeah.
Because, we're only taught so much. And then
Yes.
now, like, there's more research coming out, but also just more social media, like people talking about perimenopause and just cycle and like symptoms that are, like should not be normal, but are like really common.
Yeah.
And, specifically around like the perimenopause or just hormones in general, like what symptoms do you notice that women kind of dismiss as like, oh, this is just normal and it's fine?
I think the biggest thing is like that heavy, painful periods are just a part of being a female. I get a lot of women who are like, I just thought everyone had painful periods. Like I thought it was normal to miss like 2 days of work. And that's
Mhm.
not. And then also I think like in those later years, the first hormones that we tend to see drop is progesterone and testosterone. And so a lot of that comes with like, I'm not sleeping the way that I need to. And it's always, well, I'm working a lot and the kids' schedule is busy and the last time I get me time is at the end of the night, or like all of a sudden I want to like murder my husband because he's breathing the wrong way, or my partner because it's just like getting to that time of month. So
Mhm.
seeing more of that irritability side of things.
Yeah, definitely. Yeah, and it's been so cool, even for my personal journey, to just understand like, yeah, my cycle better, the different phases, and just having that education and knowledge for yourself so you can be more in tune with your body and
Yeah.
know like this is, I'm gonna probably be a little lower energy around this time and more energy around this time. Like it really helps to kind of work with your life and make adjustments too.
Yep.
What is like the biggest thing around like social media or the internet that you think is getting like what they're getting wrong about hormones in general around women's health?
Yeah. I think that it often, again, people just think that like being on hormone replacement is just a solve. And it's not. I think a lot of females will often talk to me about that, like, well, their hormones must be a reason that they're gaining weight. And it can
Mm-hmm.
be, but there's also a whole bunch of other factors that go into that as well, that need to be like ruled out or addressed. And so I think it's just a part of that cycle. And I think, again, that social media makes it look like it's going to be all glamorous and butterflies. And there's some people who do really well with that, and there's other people who don't. So again, I try to say like as anything, like hormone replacement in general just isn't a one size fit all, but
Mm.
there's just more of a baseline with hormone abnormalities that I think deserve to be discussed and discovered versus just saying, oh, here's a one option band-aid and that's it.
Mm-hmm. Yeah, having that full discussion around their hormones and not just like, yeah, here's the solution. Um, when women are coming to you like, yeah, thinking, hormones are a mess, like where do you start looking first?
So a big part of it I have found is that like obviously, your gut is holds most of it. So your GI system is a big part of your hormone synthesis. It regulates your immune system. It's your ability to absorb nutrients. So if your GI system's not in a good place, it doesn't matter what we do because you're not going to absorb the things that we're doing. So I tend to tell most women that I'm like, yeah, your hormones are great to look at, but they can be a shiny object of distraction that can often deter away from a bigger issue at hand. So a lot of the times they're like, "Well, I don't have any GI system problems." And it's
Mm-hmm.
like, "I bet you do though." You just, again, don't think about it in the same way that I think about it. So, I think that's a good place. A lot of people like to get a baseline of where they are. So I'm not saying that we don't do like a Dutch test because again, looking at how they process hormones, for example, can be really powerful as well. But I really think that like starting in their GI system makes the most sense.
Mm-hmm. Yeah, I totally agree. What do you think about, I'm kind of transitioning now. So,
Yeah.
now they have the name change, right? It was PCOS. Now it's the polyendocrine metabolic ovarian syndrome. What do
Yeah.
you think about that change? what they made
I
with
think
that.
it's great. I think it really it offers a broader variety of what the functional medicine space has been saying about like PMOS or PCOS for a long time because again, there's multiple different forms of
Hmm.
PMOS. It's not a syndrome or it is a syndrome, it's not just a disease, right? And so before they used to say it was, irregular cycles. This is like the
Yep.
what is it, Roderman criteria. It's like irregular cycles, androgens, and then having cystic ovaries and appearance on an ultrasound. But we know that there's actually like four different types at a minimum of PCOS or PMOS. So it's like there's insulin resistance, there's post-pill, which is like a rebound after stopping birth control. There's an inflammatory version. And then we also know that your adrenals or more of that cortisol support can also be a driver of that as well. So,
Hmm.
um, I think that's also just like a helpful thing because I think a lot of women, in my experience, don't meet the criteria of like having cystic ovaries or maybe meeting all of this. And so then they were
Mm.
misdiagnosed for a long time. So this broadened range, I think, really is diagnosing more people that it should.
Yeah, it's super helpful to like understand that there's so many reasons or types of the POMS that could be showing up for the woman. What are symptoms that you're seeing that women like when they're diagnosed with this? I know you already mentioned the four types, but like what are those, yeah, like symptoms to like watch out for?
A big thing that again I'll see is like all of a sudden people who are like, I've never had acne before, or having acne or chin hair or greasy, oily skin or hair. That can be something. Um, Having more of like stress symptoms. So like all of a sudden experiencing like anxiety for the first time, or they're not sleeping, or they kind of always feel like they're on like 8 cups of 200 milligram caffeine, just like
Mm.
buzzing, if you will. And then obviously again, we'll start to see weight gain at a higher propensity.
Hmm.
Can be one of that or blood sugar dysregulation.
And why are some like because now, right? I don't remember specifically the statistic. I think it's like 1 in 8 or 1 in 9. Do you know how many
I
women?
don't remember.
Yeah,
Yeah.
I think it's around there. But like, why do you feel like it's so many women are getting diagnosed with that right now?
I honestly think it's because we've been overprescribing birth control for how many years and like just
Hmm.
that was the solve. I also think that a big part of it is our food. Is like
Yeah.
there's a lot of changes to the quality of our food. We also like stress impacts too of like now women are working and they potentially have kids and you also have to maintain this culture of feeling like you need to be this certain size to have self-worth and it's kind of all these things combined.
Hmm.
And unfortunately, there's not enough hours in a day. So naturally we start to see signs of dysfunction. So I think that's honestly, I think that's where most of the POMS is coming from.
Yeah, I agree. Food, stress, like you're saying, so much stress, even just the overstimulation we have with technology and like being on a computer all day and not getting outside, like and like you said, there's only so many hours and as a woman, most of the time we're high functioning, so we're like, we need to do this, we need to go for a walk, we need to get a workout in, and it's just a never ending cycle, which leads to even more stress.
Yeah.
What role does the blood sugar and insulin play in all of this?
Yeah, so a big thing is, we tend to say that when you have blood sugar dysfunction, we know that this can impact cortisol. So every time your cortisol crashes, that's sending a message to your body that it's not getting the support that it needs. So it comes dysregulated in that insulin production. And I like to describe because I think there's a lot of like misnomers about
Mm-hmm.
what insulin resistance looks like. So I usually tell people of like, think of as I eat 100 units of sugar. Your body, when it's sensitive, should make 100 units of insulin in production to that. When it becomes resistant or dysregulated, it says, I eat 100 units of sugar, and this time I'm going to make 75. And the next time, even though you still eat 100, I'm going to make 125. And oh, like Sarah's not eating, but she might be. So I'm going to release 25 just in case. So we start to see that things just are happening based on our stress. And again, that's where we see like more of that blood sugar. And that
Mm.
changes how then your ovaries signal to testosterone or again, that other hormone DHEA in response to that.
Which is insane. Again, our bodies are smart. They're developed like so well, and all the like you said, your gut affects your hormones and then your insulin. Like they're all connected. And I think
Correct.
it's important to recognize that. What are so like kind of going off of this, like what are women doing in regards to like diet and exercise that may be actually backfiring, leading to like more, more stress or more concerns?
Yeah, I think a lot of it, and I'm sure you see this too, is this like the skinny culture is coming back. I feel like for so long we were really being proud of like being strong and being healthy. And again, I'm not here to like body shame people by any means, but I think there's now this new ideology that's coming back like it was in maybe 90s or when our parents were around that like I need to be a size 2'4". And so what I'm seeing is that a lot more women are being like they're doing keto, so they're not eating carbs, and they're also going prolonged periods with fasting. And so
Mm-hmm.
that also is driving stress from your adrenals when you're not getting adequate sources of protein. You're not getting the B vitamins and magnesium from some of those complex carbs. And then you're going longer windows of before you're eating again, and you're just relying on coffee or caffeine to kind
Mm-hmm.
of like hold you over, which again is more stressing on the GI system.
Yeah. I think fat, yeah, what are your thoughts on fasting for women?
I think it can have a time or place. Like I've seen it really be successful, especially in that postmenopausal period, or for people who are truly going through insulin resistance, that it can serve as a bridge. But often, what I've seen in my practice is that more women need to be eating smaller meals more consistently with a specific focus on protein than it is going to be of like, oh, I can just eat whenever I want. And like
Mm-hmm.
eating quick course or quick carbs is going to be fine.
Yeah. No, I'm right there with you. I'm always like there's a time and place for it. Like it can be helpful for certain cases, but I think a lot of times, yeah, we're seeing a lot of women will overdo it or see that there's a lot of benefit or they see some their friend like lose a bunch of weight, so they're like, okay, I'm gonna try it too, when they
Yeah.
could be like in a more chronically stressed state and actually backfire with, not actually getting enough calories because then you're running on, yeah, coffee,
Fumes.
probably not getting enough nutrients in general. Like you're saying, if you're only eating within, 10 hours or 12 hours, like sometimes a woman might only eat one meal or two meals, and that's not really hard to get enough protein in that and fiber in
Yes.
just those two meals.
Well, and you're right, because I think again, a lot of the times too, it's like it works and it'll work for most people for a period of time and then it won't. And then
Hmm.
you'll be like, oh, I started gaining weight back, but nothing changed. Like I'm still fasting like I was, so I'm gonna push it. And so it's like again, that culture of like I'm under eating and over exercising and I'm not sleeping and I'm over caffeinating.
Yeah.
And it just is like, again, a recipe for disaster because long term, you're not getting those nutrients that you need.
Yeah, I agree. Yeah, it's wild, especially with all the information we're seeing of like the skinny culture again. And it's like, no, let's go back to like strong is healthy, like having muscle mass on your body is so healthy.
Yeah.
When you're seeing, so yeah, going off of the stress, like when you're seeing a lot of people dealing with this adrenal fatigue or chronic stress, like where do you suggest patients to really start realistically to make some
Sure.
lifestyle changes or whether that's lab work or,
Well, I think a big part of it is like, you can eat perfectly and still have dysregulated hormones if you're sleeping 5 hours and running on adrenaline. So, cortisol and insulin are still in that constant conversation if you're not sleeping. So the biggest thing is like sleep and stress need to be addressed. And like we have to get you prioritizing like 8 hours of uninterrupted sleep. And then I really like to look at like movement in that term. So, doing chronic cardio, especially fasted, um, pausing on HIIT workouts of like,
Mhm.
the HIIT workouts are again are just increasing more stress response. So really try to tell women like strength training, walking, yoga, Pilates is going to be beneficial while we're telling your body you're not getting chased by a lion anymore. And how do we kind of rebalance that? So I usually say like sleep and movement are our first two biggest pillars,
Mhm.
and then we can kind of focus on, blood sugar as that foundation to keep it moving.
Yeah, sleep is so necessary for repair, recovery, everything, and yeah, everything like that too. What do you, anything else you want to say as far as with the palms that needs to be addressed or that you find you want to debunk or anything like that?
Well, I just think again, there's a lot of like supplements out there that can be really important, but they're not just a shortcut, right? So again, a lot of it needs to be individualized based on your needs and what your body needs. So really just kind of pushing for some, lab work or working with a functional provider to make sure that, you're looking what your fasting insulin is, you're checking your thyroid because that's a huge part of POMS at baseline that I think goes unchecked. And then again, just looking at, your vitamin D and magnesium and ferritin and all of that.
Mm-hmm. I like that. Yeah, especially looking at those blood markers because it's probably multiple different factors you want to look at, or also looking at the gut, looking at their vitamin D levels. Um, are all super important too. When we go into later or like more, perimenopause, what age is this typically showing up for many women?
So they say that perimenopause, well, it's interesting because it happens like 10 years before. So I tell women of like, it can really start at 37 or 38. And like as a young age, but oftentimes I tend to hear, most people between 41 and 42 are where they're like, oh, my sleep changed, um,
Okay.
where I was noticing this.
And, when, so say a woman comes in, right, they've been having some perimenopausal symptoms, and they say, like, I really want to be proactive with this
Yep.
during this time. Like, are there any themes that are coming up, like, as far, besides like weight gain?
Yeah, again, I tend to see that most of the biggest symptoms are like, is anxiety or depression, which is like a new onset in the 40s, like 40 years of age. ADHD, especially like brain fog or attention, and that's usually because estrogen changes. And with that, we'll see thyroid dysfunction. And then again, I tend to think of insomnia as being one of the earliest signs of like, I was always a good sleeper. I could go to bed and I'd knock out, and the kids could be loud and I wouldn't wake
Hmm.
up. And now all of a sudden they're like, yeah, a pin drops on the floor and I hear it.
Oh my gosh. And how do you support women through this transition?
Yeah. So again, I think a lot of the times when it comes to, it's addressing what their things are. So when we know that like there's low progesterone, poor sleep, irregular cycles, PMS, heavy periods tends to be more of those like leading symptoms for that. And then again, I usually see that cortisol dysregulation of like wired but tired, weight gain, blood sugar comes through. And then we start to see, I say low libido tends to
Mm.
be, fatigue, muscle mass, kind of motivation decline for testosterone being depleted. And so a big thing is, looking at, again, gut health can be a huge role in this, but this is where, again, some of the more like hormone replacement can be really helpful. I tend to find most women do really well on bioidentical progesterone. There's lots of different forms. There's a pill that you can get from your local CVS or Walgreens that's still bioidentical. There's obviously topical creams or troches that melt in your mouth, or there's herbal support for that, like Vitex, that can be great.
Yeah, I was going to ask you your thoughts on that too. The
Yeah,
Vitex.
Yeah, Vitex can be really helpful. It's really subtle, it's really conservative. So people who have more of a sensitivity to medications, or just want to trial something, obviously with talking to a provider, this can be a wonderful support to start with. I tend to say that it's going to be most beneficial in that luteal phase because that's when we're supposed to see that progesterone is rising. And so usually we think after ovulation to the start of your period, or think again day 14 through 28 of a normal menstrual cycle.
Hmm. Can you touch on like the difference between bioidentical hormones and like the synthetic hormones and like more about this replacement therapy?
Yeah, so bioidentical progesterone, or again, like a lot of people will say BHRT is like what you'll
Oh.
hear somewhere. Bioidentical progesterone is going to be mimicking what your body should produce. So again, I'm going to just use random numbers of like your body should be producing 15 nanoliters of progesterone during the luteal phase, and it's only doing 5. So bioidentical progesterone is saying, hey, I'm going to meet that. You're producing 5, so I'm going to produce 10. We're going to try to
Mm.
like, kind of address that hump, but it's the same hormone. The more of the synthetic hormones are going to be progestin. And so that is what we call a mimicry hormone. So it's not going to be the same as a bioidentical, but we can see a lot more like Some women will actually gain more weight on this form of progesterone. These are often comes in like forms of like birth control, like a mini pill, or even just like a normal birth control. But these are going to be more, again, synthetic derivatives, meaning coming from other sources than what your
Hmm.
body makes.
Okay. So when you're using that bioidentical hormone, is it always matching your hormones? Like it'll or will like you have to dose it correctly, like based on body responses? Or
We're basing it based on body
okay.
responses, really, and kind of more, I honestly will say like a numbers are just a evaluation at that standpoint. It's really more based on like patient symptoms.
Hmm.
So, like how is your sleep? How is your irritability? How is your bloating and your weight gain? Do you notice improvements in that? And that's kind of where you find that sweet spot. Now, again, some women take like, I'm just going to throw out random numbers of like some women only take 50 milligrams from days 15 through 21 because they're like, I don't want to rage kill the world. Like my sleep's just not great. And then that day 22, as they get a week out from their cycle, that's when they increase to like 100 milligrams because then they're like, I'm needing more support and this feels sufficient for that.
Hmm. Okay. Very interesting. Thank you for sharing that because that's something I haven't looked deeper into the bioidentical hormones. Um, what role does, we talked a little bit about stress, but in terms of this
Yeah.
phase, like the perimenopause, like stress and nervous system health, like how does that play a role in this, yeah, in this time?
It's kind of all of that same thing. So we tend to think of like as estrogen decreases, it also affects your stress resilience. So we know that like most women, again, you go through your 30s and like again, I'm going to say 40s of like your childbearing years, whether you decide to have kids or not, or you advance in your career or whatever that looks like, is like you do so much for so long. And then we see in your 40s, it just kind of catches up, unfortunately. So it's like you've already had HPA or that adrenal dysfunction for 10 years now.
Hmm.
And now it's like, hello,
Yes. Now it's
hey,
like,
I'm here. Are you going to pay attention? Because I've been trying for 10 years to get you to wake up and you haven't yet. So again,
hmm.
I feel like estrogen really can just make that stress response even worse, and make us more like snappy.
So would you like, is it fair to say that if, yeah, someone wasn't supporting, stress management and, lifestyle, like nutrition, movement, before perimenopause, would their symptoms tend to be worse off in that perimenopause?
Yeah, we can see that perimenopause can get worse if they're not addressing it. And that's not like a scare tactic. Some
Yeah.
women again go through perimenopause and are like, I felt great, or I went through
Hmm.
menopause and I didn't even know that the sun wasn't shining all the time. But really, I say is like setting your body up for success starts as soon as you can. So really focusing on, especially too, like again, I'm going back to women who choose to have kids is like that is a huge nutrient depletion, right? And again, whether you choose to breastfeed is also a huge nutrient depletion. And so, again, we have this culture of like snapping back to the way we were and getting back to this like everyday routine that often what I find is it's harder for moms who just like put everybody else first
Hmm.
for so many years that it just kind of catches up at some point in their 40s.
How do you, so now I'm going to transition since you brought that up, like the pregnancy. So,
Yeah.
say they were going through, yeah, pregnancy at that later age. We're seeing that more and more too, like 35 or say like 36. I've seen different studies show up that it does kind of prolong like the perimenopause kind of symptoms or when they go through that. Is that correct? Or like, how does that affect menopause? If they're
Yeah,
having.
because it pushes, again, it's saying that your fertility window is longer, right? Because we think of every month that you don't get pregnant, you release an egg, right? And your body
Hmm.
says, oh, you didn't get pregnant, so we got to plan for next month because maybe you'll get pregnant now. Well, when you go through like pregnancy and potentially breastfeeding for some, you don't get a cycle. And so you're pushing back that hormone time frame by a year. So you're keeping those eggs that you would have released. And so we're seeing that it can delay perimenopause or the onset of menopause for some women. There's also more literature that's coming out, even though I hate that it's still labeled geriatric pregnancies. It make me drive someone through a wall. But we tend to see that actually women who have babies, they say after, I think it's 34, you're more likely to live until you're 90 from that hormone support.
Wow. Yeah, I think that's what I saw too. And I was like, oh my gosh. Like my mom, she had me at like 41, which it was crazy at that
Amazing.
time. Um, But yeah, then I saw that, so I'm like, okay, well, you maybe live way longer, so that's good.
Yeah, and again, I think that's where again that conversation about like women being on hormone replacement is a good thing because we know it protects your heart, your bone, and your brains. And if you're having babies later into life, then again, I think it's very different than our grandparents' generation who they were like done at 25.
Mm-hmm.
And now I feel like more women are like, trying to get established within a career, want to, everybody has their kind of benchmarks of where they want to be before they maybe start that conversation. But the average age for most females right now is like having their first kid around 29 or 30.
Mm-hmm. Yeah. And is there anything that you'd recommend looking into to be proactive around their hormones, like whether they are, you know, planning to have a kid, but then also like going in, menopause? Like, when is a great time or like benchmark to be proactive with that?
I really think, there's, again, kind of transitioning a little bit to the kid side for a minute is, there's a lot of literature that says the first 1,000 days of life is impacted by mom and dad. And so I really try to tell, parents that like you should be thinking about what like the impacts of your health like 6 months before you actually want to get pregnant. Making sure your nutrients in are a good plan, making sure you have good stress response, making sure you're moving your body, you're limiting alcohol, you're getting good sleep. And that really is going to then set your kid up for the first 1,000 days. But we also know that mom's microbiome, like how her gut health is, also can impact her kid's ability of developing heart disease, diabetes, eczema, and allergies. And so I usually try to tell moms like a year before you want to get pregnant, that's when I would say like good to get some baseline blood work, good to get a gut health assessment.
Mm-hmm.
And then dads too is like you should be getting labs 6 months prior and also making those commitments because we know a lot of like, sperm impact on preeclampsia. We know that sperm has impact on vitamin D, which is how the baby's immune system regulates. We also know that dad plays a huge role on baby stress response. So
Mm.
it's not just a women's issue. So, and then as we move into that perimenopause period, it's like being really intentional, especially if we're done having children, on like how we can restore our bodies after taking such a long gap of maybe putting other people's first.
Mm-hmm. I love that they're bringing in that conversation around male fertility now
Yeah.
too. Like, I think that's so, especially like you said, those studies of how sperm health, yeah, really impacts the baby's, yeah, immune response and all that. Like, that is so huge because I don't think that was like a big conversation even just, yeah, years ago. Um,
Right.
yeah, so like not always about the women.
No, and
And
again, I tell people in my practice from the fertility side of things that I'm like, if you haven't conceived within 6 months, my first role is not to check the female's hormones, it's to make sure that we do a semen analysis. Because
mm,
I want to make sure that like dad actually has swimmers that are viable before we go. And like I think again, more conventional is like how do we pump her full of hormones? That they don't often check like male causes of infertility until again like a couple is a year and a half in, and then again it's like she's now been on all these things that maybe don't she didn't need or don't make her feel good for a year before dad is even assessed.
yeah, wow, that's crazy. Um, and so you, yeah, I assume you work with a lot of that type of patient as well, like
Yeah,
infertility.
absolutely.
Okay. What is one thing you find that women are keep chasing that you think is distracting them from the real issue around like menopause?
Yeah, I think that a lot of the time, again, it's that one gaining weight and I should just like eat less and move more. And then they also will say, well, my doctor said my labs are normal. And it's like they're not though. I mean, standard labs are looking at like a snapshot and they're also a huge range. Like, how can we say your labs are normal when the spectrum is anywhere between like 5 and 500 and you are one tiny blip on that? So I really just find that again, that's where working with a functional provider can be so beneficial because I can't tell you how many patients that I see that are like, well, it said all my labs were in range and you just told me that I have nothing that's normal. And it's like, yeah, but it's also validating because it's like
Mm-hmm.
I've been feeling this way for so long, and it's nice to finally get, symptoms that are addressing what you're seeing.
Yes. So true. Yeah, since I think, yeah, I shared with you, I'm really recent in this integrative health space and like looking at blood work and
Yeah.
that was like one of the first things that came like was so shocking to me when I was like looking at these numbers. I'm like, the range is ginormous, and like I
Yes.
would look at it would say like in range, yeah, in range, and then I would look deeper, and I'm like, oh my God, these are so off. Like, but so that's like so hard and frustrating for the patients that are going, to their doctor having these symptoms and yeah, just kind of being dismissed, thinking it's fine when it's yeah, the normal
And
range
I,
when it's not.
Yeah, and I think it's hard too because I am not oblivious that I know that, some of this functional medicine is an adjunct care. It's also an expense, right? Because it's not covered under insurance. You can use like HSA or FSA with different providers. I know I accept HSA or FSA, but that's something that again, they're like, well, I can't do it because insurance doesn't pay for it. Or I just want to run it through insurance because maybe they'll do my labs. And I had a patient who wanted to do all of her labs through insurance, and the bill came back at like $2,000, and it normally would have cost her like 175 to do it at a wholesale cost.
Oh,
Uh,
wow.
so I tell people, I'm like, I hear you. And you're also paying, think about like premiums. You're paying $1,000 a month to maybe go to the doctor twice a year, that
Mm-hmm.
ends up being more expensive than like seeing again a
Totally.
functional provider and being proactive about your health.
Yeah, that's good to know. You take HSA, FSA, and then no insurance, right?
No
Otherwise, cash
insurance.
based. Yeah. Um, and
We
then
provide like super bills for like
okay,
reimbursement. Yeah.
kind of going off the blood, yeah, like lab markers. Like, what would you recommend that would be helpful for women wanting to seek true answers for like hormonal concerns? Like, what are some lab markers to look for, especially with like um the yeah POMS and then perimenopause.
I tend to think, especially with, and this is going to be different for like POMS versus perimenopause.
Yeah.
Looking at cycle dependent hormones for perimenopause. So, again, 5 to 7 days post ovulation is the best time to check estrogen and progesterone, testosterone. Also, looking at like FSH and LH, and that's going to be more contextual, but can tell women of like how close are you to menopause potentially. Um, again, the full thyroid panel, this includes like your antibodies and looking at reverse T3, not just a TSH, because again, most women are like, well, I had my thyroid checked. And I'm like, okay, can I see your labs? And it's just a TSH. And that's just one marker of a cascade that really doesn't impact. HSCRP is an inflammatory marker. This can be really huge. It also can be a precursor for risk for heart disease, which we know can happen for women, especially going through hormone changes, that they should get evaluated with a calcium CT score, especially with a higher family history of cholesterol imbalances or a personal history of that. And then again, like vitamin D, magnesium, iron, ferritin, B12, folate, all of the stuff. With POMS, again, really focusing on fasting insulin, glucose. There is some stuff too where this would be a time and place where you could consider doing like a day three, um, FSH, looking at estrogen at that time period too, LH in particular, and then also looking at AMH, which is that ovarian reserve, because that can be a good marker for
Mm.
POMS as well.
Okay, cool. Love it. Thank you. And then what has been like your favorite client success story that you've had recently?
Gosh, I love them all. I will say that I had a female that I have seen for over a year and I'm going to say a year and a half. And we were able to get her diagnosed with endometriosis and adenomyosis. We started her on some LDN. She ended up having a couple incidences of infertility before she even came to me. And it was like really exciting to finally get the like message of like I'm pregnant, and I get to
Oh,
see those two little lines. And she's currently almost in her third trimester. She's doing really well. Pregnancy has been eye-opening experience, but again, it's like you feel all of those things as you're going through people's journey. And we found out that she had SIBO, and that was causing her hormones to be low. And we found out that her thyroid wasn't where it needed to be. And like again, starting her on some thyroid medications got her pregnant, like within a month.
wow.
So again, we talk about kind of sub bars like your TSH needs to be under 2.5 in order to conceive for baby's development. And so that doesn't mean that Just having a TSH at 3 is normal, especially if you're struggling with infertility. So again, I think about my patients all the time. I say it's something that like I don't just shut my brain off when our visit's done. It's something that I'm constantly researching of how can I be better? Are there new research that's out there? So anytime a patient's like, I feel better, it just always feels like a win.
That's so awesome. That's so awesome. Yeah, and that just speaks volumes to like how much you can really help a client look deeper into why they were struggling for so long. And I'm sure she's so happy to finally have those answers and to be pregnant.
Yeah.
Um, when I was going to ask you about, yeah, like your, I'm glad you mentioned the thyroid in terms of like being, yeah, like fertile and having fertility. Um, I know there was some research, but like, how about like vitamin D or even, um, yeah, any other markers like that you tend to see that shows like, oh, these are signs that you could be infertile.
So, first off, in Minnesota, 96% of people are vitamin D deficient. Everybody always likes to tell me that they're like, I go out in the sun, and I'm like, unfortunately, we're too far away from the equator for it really to give it like make a difference. So, um, most Minnesotans, when I test their vitamin D, who are not on supplementation, come back at like 13. And for
Holy
reference
crap.
range, we want this between 60 and 80. Conventional standards are normal after 30, but we know that vitamin D is a master hormone that helps with testosterone synthesis. It helps with mood, really big for seasonal affective disorder, PMDD, and then also plays there's a lot of literature on egg quality and that consistency too, but we also know it impacts sleep. So it has some cortisol overlap. So vitamin D is great for that and really helpful. I will also say that again, H. pylori is one of the things for a secondary infertility or unexplained infertility, as more of the conventional standards do. So H. pylori, 50% of people are asymptomatic, and it can affect both partners in terms of treatment response. So, and then we tend to think of mycoplasma, urea, and pneumonia from the urine or from the vaginal microbiome can also cause inflammation. And so addressing all of that, I say, is like more of those avenues that you just want to make sure you're uncovering with people who are not
Mm.
getting pregnant.
And those you can get the urea, right? That's through blood work, right?
You can do a blood
Yeah.
work. There also is some different, like I say, like Envy is or Evie is a test that you can actually do a vaginal
Mm.
microbiome swab, which is cool. There's a couple other tests called like an EMA, that's a endometrial biopsy, more for patients who have like endo or adeno, that your OB, you can like we'd order and then you bring to your OB for that.
Mm.
But yeah, and then H. pylori is a stool test.
Yeah. Okay. Yeah, glad you touched on those because those are all like, again, things that some people probably dismiss or don't even think about. 96% deficient of vitamin D, that's a huge
Yes.
percentage. I know, and I always tell people, I'm like, you're taking vitamin, or you may not, yeah, they say they're getting outside, but I'm like, you're probably still deficient if you're not actually getting a tan. And yeah, living where we are, like in Minnesota, it's like really
And
hard.
I think again, like we always, the first thing that people do, right, is they put sunscreen on and then they go
Yes.
outside. And it's like go outside for 10 to 20 minutes before you even put on sunscreen. So that way you can get some absorption of
Mm.
any vitamin D that's circulating. Nothing today, but I think that's help. And then again, I hear just because we're in the Midwest, well, I drink milk and there's vitamin D in milk. And I'm again, not enough. So
We're debunking all that. Yeah,
yes.
making it clear. Okay, a little rapid fire. So, like, what is the biggest thing women should stop doing for their hormone health?
Thinking that they can undereat. Like again, just going long periods without eating meals or eating, focusing on calorie restriction. We know for hormone synthesis that a minimum calorie intake for everyone is 1200. And again, I would say most women try to shrink themselves to eating like 8. So,
Mm,
eat your food and focus on protein.
yes. Just eat. Food is fuel. And
Yes.
I mean, I often find like, especially, I don't know if you can relate to this. Like, a lot of women too just struggle with the emotional attachment to food, or just like, especially because of the skinny culture and like taught to eat less, move more. It just like kind of is so mental to really trying to reframe how you're viewing food as fuel and energy for just hormone production and like supporting your gut. Like
Just
trying to,
basic life, you know?
yes.
Yeah.
Yeah, and it can be hard though to kind of being patient with that process of like retraining your mind to be like, no, this is energy, and especially when you're getting quality food
Right.
and from the earth and not yeah out of a box. Um, the biggest thing women should start doing.
I would say prioritizing their health over others. So, my favorite saying for this is remember when you're on an airplane and the airplane's going down, the first thing they say is you have to put your own oxygen mask on before you can help others. I think that most women are just so devoted to their friends and family and all the people around them that they forget that their own oxygen mask has to be placed. So,
Hmm.
really say it's like putting an emphasis on their health.
Yes, totally agree. What
It's
is
not
one?
selfish too.
Yes, that's another thing too. Like people think it's very selfish. Obviously, I can't relate, like I don't have kids yet, but I can understand like how it could be hard to think of it as being okay, but if I'm like doing my workout, like that's selfish because then I'm not with my kids. I'm like, no, but then you're gonna give more to them and like more
Correct.
energy to them. What's one piece of advice you wish every woman heard earlier, like in life around their health?
I would say the importance of understanding your cycle or tracking your cycle. Again, I don't know about your experience, but my experience in high school and even younger years, it was like you get a period. You should bleed once a month. If it's not normal, there's birth control. And I really wish women knew the phases of that
Mhm.
cycle and again, really understand what their hormones are doing during that time period because that just helps. I think most women don't think about it until they want to get pregnant. And then they
Mm.
find out that maybe it's not as easy as you think to get pregnant as they like scare tacked you in high school thinking it is.
Yes, yes. Definitely had to unlearn that. Yeah, of just like yeah, how it can be really challenging, especially when we are seeing different cases of infertility and these um and just having that when you understand your cycle better, like I mentioned before, it just is so empowering to like know that about your body and knowing that you are going to have those natural shifts month to month. Um,
Yep.
what's one wellness trend like that's happening right now that you disagree with?
I'd say vibration plates.
Mm-hmm.
Because you really don't need a vibration plate if you're moving your body and drinking water. Your lymphatic system is doing what it needs to. So I feel like, again, it's just like another fad thing to have. That I really, if it works for you and you feel great doing it, wonderful. It does have a lot of benefits from like the muscle recovery side, but I think a lot of people do it because they think they're just going to drop a bunch of weight from like feeling puffy, and I just have not seen that to be true.
Mm-hmm. Yeah, I think I saw like a video the other day where someone was on it and literally it said that it was like I did this for every day and I lost so much weight. I'm like, oh my God, no.
Oh.
You're probably doing so many other things.
Yes, correct.
What's one thing most people overcomplicate about their health?
That it again needs to be like you have to take all these supplements and it has to be like you can't live a life of balance, especially even with food. I think that life is supposed to be 80/20. That if 80% of the time you are eating whole, consistent foods, like going and getting ice cream is not going to be that detrimental that like messes up your life. Or again, if you skipped a workout because you just weren't feeling great, that's going to make you gain 5 pounds. Like really, it's how do we stay in that consistent pattern over time and making good choices 80% of the time that like
Hmm.
the 20% really doesn't matter.
Is there any tip you have with that as far as like being consistent?
The average for you to establish a pattern is like 21 days. Like that's what all the literature says, that if you are consistent for 21 days, then it becomes like a part of your daily routine. I think as like a busy mom myself, that like habit stacking is everything of like, in the morning when I like drink my tea, it's like I'm doing my red light and I'm doing my gratitude journal. It's like I'm starting my day off already doing like three different things that are beneficial for myself. And it's no exception. It's every single day. So,
Mm,
it's trying to figure out ways that it works in your life, and that doesn't mean that it has to also be forced.
yeah. Yeah, that's a very good point. Like learning how to also be like flexible and like you said, to be do multiple things at once. Like if you have to take a call, like maybe you go for a walk on your call. Like something for me, like if I'm on like calls or like doing work, like understand that I can take 10 minutes or 5 minutes to go stretch quick or go like move my body for a little bit, then come back. And it's not gonna be the end of the world. I think we just get stuck in these loops and I fall victim of that too, where we just get stuck in like our routines that it's very easy to like forget that we are in control, where we can set aside the time to have an actionable step to improve your health. Um, what are other practices that you're really into right now as far as like innovations or like um like biohacks, anything kind of in this health space that you really want to share or talk about?
I do really like peptides. I think they're getting a lot of buzz right now, and a lot of people are thinking that they're a new thing, and they're not. And so I like to tell people, peptides are building blocks that your body has already made, and that system's just not working effectively as it once did. So again, peptides can really serve as a bridge while you're repairing other areas of support to just provide people to feel back in their body, to maybe get some energy back, to fix or reroute some other things. But peptides aren't for everybody, and peptides aren't needed for everybody. So again, I say like, GLPs fall under that peptide category, and they can be great to help with people who have Hashimoto's to decrease their antibodies. It can be great for POMS for more of that cycle regularity to help with insulin, but it should just be an indefinite of like, well, I can go on this and just eat like crap and not move my body, or I can still just do this and kind of half-ass the rest of my life. So again, a lot of them are bridge tools,
Hmm.
but I don't think they're an indefinite means.
Do you offer those too?
Yeah.
Okay.
Yeah.
Um, do you, work with a lot of peptides with your patients?
Do.
Okay.
I think the biggest one that most of my patients are on is BPC 157 for inflammation.
Mm.
I find that from an injection standpoint, it's really good at tackling that. It also helps with gut health and tissue repair and collagen production. I also do a lot of like NAD injections. That's going to help with cellular repair, helps with energy, mitochondrial support, this like blanket stream of like helping against oxidative stress. Again, a lot of people are on the various forms of GLPs support to help with inflammation or weight loss. And then I would say the other big one that I tend to see or like maybe has grown a little bit more um, focus has been like thymosin alpha. That one's really good for more immune system regulation. Can also be really good for people who have like Epstein-Barr or more of these chronic viral
Mm.
processes.
And how long do you have, patients on those for?
So it depends on the peptide. So most of them are on it for like 8 to 12 weeks and then they cycle off. Some of them are only on it for like a short stint where it's like they're only on it for like 21 days.
Mm.
So it really depends on like what our goal of therapy is. It a new injury or an old injury, or are we doing this more for like chronic repair? Again, most of the time I tell people is like I'd say an average is 8 to 12 weeks.
Okay, cool. And one of my last questions is like, we talked a little bit about the lab markers, you shared with like perimenopause and POMS. And is there one or like a few that lab markers you think that is not getting enough attention or that people, kind of dismiss, that maybe show up as normal, but like is really important?
I just again a lot of women, especially in perimenopause, I feel like your symptoms and history almost matters more than just the labs at that stage because your labs are just fluctuating
Hmm.
day to day, month to month. But I will say the importance of cycle dependent labs. Like most women are like, yeah, my doctor said they'd run labs, but I just did them anytime. And then it's pretty irrelevant in terms of timing. So again, just making sure that like it's 5 to 7 days post ovulation and you're tracking this with like LH strips or temperature monitoring or some other device that works for you for that.
Okay, love that. Anything that you want to share that we didn't mention or go over with like hormonal health or
No, I really mom's really starting to have conversations with, those daughters around 13 is huge or, it's 12 sometimes with these cycle changes. But again, doing better for our kids than maybe we had the opportunity to do for ourselves. But also I think that shows, again, especially I'm just speaking from like the next generation, but I think it shows them that importance of our health. So I
hmm
really think that, by us setting our bodies up for success, we're also demonstrating to our daughters of like what should that look like and how can we help support them more. So
yeah. Do you think that's appropriate, like, around that age to, like, as you're sharing about their cycle, to, like, have them start tracking?
yeah, absolutely.
Yeah.
I think they should know, again, like they should know their body. So most of the time for like when I see my younger patients who got their period, I will literally print out a calendar and I color code the calendar with the different days and we talk about what this means and what that feels like in their body. My like I say my pipe dream is that I can go around and do education in the schools for like kids with this and
Mm.
with their moms. But I think it's just so important. Like the longer or earlier we talk about it, the more we're going to decrease that awareness or that need for like these band-aid supports in between that.
Mm-hmm. Oh, I love that. That's such a great idea too to have it in schools. Because, like
Yeah.
you said, we just get like one class on preventing pregnancy, and you bleed once a month, and that's it. Like they don't really share about the different phases or how long like your period or menstrual cycle should be when it comes, like what's healthy, what's
Exercise
not.
to do. Yeah.
Yeah.
Yeah,
Um,
I always think of the Mean Girl reference of like you're gonna have sex and you're gonna get pregnant. When you get pregnant, you're gonna die. It's like it's not like that. Like you again, your likelihood of getting pregnant is at its highest 38% for 2 days. So it's again, it's like we fear these women of like you have to go on birth control. There's no other options if you're sexually active. And it's like, nope, you can actually learn about your body. Not
yeah.
promoting that like kids having sex at a younger age,
Yeah.
but I'm also not oblivious that it's not happening.
Yes, yes. 38%. I actually didn't know that.
Yeah,
38%.
38% is on your highest day. You like 2 days before your period or before ovulation, it's like 36%. Then it drops to 34% the day before ovulation, and then 38% the day of ovulation.
Wow.
Yeah.
Did not know that. Like the more you
Yeah, so
know.
it's like really again, like your odds are we're gonna say like 1 in 3 if that
Yeah.
it works out.
Crazy. Well, this has been so fun. I want to end with my signature question for every guest that I have on the podcast. Since my goal with this is to really help others like overcome their fears, lean into growth in all aspects of their life. What have you done in your life that allowed you to experience tremendous growth, but took letting go of your fears to get there?
I think it's just the daring to be different. I was the first in my family to get like a medical degree or go into this space. And, often they call me like the witch doctor or more of that like woo, because we buy organic and I care about every product that comes into my space. And so I think letting go of the fear of what other people think or may kind of see as all of those kind of, being crunchy or living this crunchy lifestyle means. Again, that doesn't mean that I don't get to enjoy ice cream or that there's not an occasional Diet Coke once a year. But I think that not giving fear to how other people view us is huge.
Such a great message. I'm so happy you shared that. Because I think it can be hard. I think a lot of people can relate to that. Like when you start making changes to your health and maybe you have family or like friends, they'll say something like, oh, it's fine, or like kind of pressure you into doing something
Yeah.
that maybe is not something that you act, yeah, like want to choose to do. Um, it can be hard to like let go of that. So love that. And then where can people find you?
Yeah, so I am on Instagram at Hannah Lewis FMP. I have a Facebook page for Wildly Well Functional Medicine, and then my website is www.bewildlywellmn.com.
Love it. Yay. And then, so they can find you on those. And then, yeah, how do they reach out to you on there? Do they schedule a call? How does that
Yep, so
process?
there is a like contact me form that goes through if they have specific questions that will send me an email. There's also an option to like book now directly where they could schedule a new patient appointment that way. And then all of my contact information for like my phone number is also listed for my business stuff.
Awesome. Yay.
Yeah.
Thank you so much, Hannah, for coming
Yeah,
on
thank
here.
you.
Yes, I hope you guys enjoyed this episode. And I love that, Hannah is a nurse practitioner, she's prescribing these medications, something that I do not do, and works with hormonal replacement therapy, again, something I don't offer. So I'm really happy she came on, and it was such a valuable education piece on perimenopause and POMS. So thank you for coming on.
Thank you.